1. Which of the following is not considered a primary characteristic of antisocial personality disorder, ASPD? A. Repeatedly violating the rights of others. B. Chronic lying and deceit. C. High levels of empathy and remorse. D. Impulsive behavior. 2. Which of the following is the most effective treatment for ASPD? Antidepressants. B. Cognitive behavioral therapy. D. Group therapy. 3. Which of the following would most likely be assessed when diagnosing a person with ASPD? A. History of childhood trauma. B. Repeated criminal behavior. C. Family history of mood disorders. Cognitive ability. 4. Which personality trait is often associated with individuals with ASPD? A. Conscientiousness. B. Manipulativeness. D. 5. How does the DSM-5 describe the onset of antisocial personality disorder? A. Beginning in adolescence or early adulthood. B. Sudden onset in adulthood. C. Primarily evident in childhood. D. Only diagnosed after the age of 40. 6. Which of the following is a key characteristic of the assessment for ASPD? A. Lack of motivation to improve. B. Regular psychological testing. C. A history of destructive behavior. D. Consistent attendance in group therapy. 7. Which of these therapies has shown some effectiveness in treating ASPD? A. Psychodynamic therapy. B. Electroconvulsive therapy. C. Cognitive behavioral therapy. D. Art therapy. 8. In which age group is antisocial personality disorder most commonly diagnosed? Adolescents. B. Young adults. C. Middle-aged adults. Older adults. 9. What is a major risk factor for developing ASPD? A. A history of depression. B. Chronic substance abuse. C. Strong social support systems. Positive parental involvement. 10. Which of the following is most often used in an evaluation for ASPD? A. Standardized IQ tests. B. Self-report personality assessments. C. Behavioral analysis. D. Electrograms, EEGs. 11. What behavior would you most likely see in a person with ASPD during a psychological evaluation? A. Unexplained outbursts of emotional expression. B. A strong desire to form emotional connections. C. A pattern of manipulating others for personal gain. D. A high degree of introspection and self-awareness. 12. Which of the following is not a common co-occurring disorder with ASPD? A. Anxiety disorders. Substance use disorders. C. Depressive disorders. D. Paranoid personality disorder. 13. Which of the following best describes the behavior of someone with ASPD in the workplace? A. High levels of cooperation and empathy. B. Consistently breaking rules for personal gain. C. Excellent communication and teamwork skills. D. Strong desire for structure and routine. 14. How do people with ASPD generally respond to authority figures? A. With respect and admiration. B. With fear and avoidance. C. With defiance and disrespect. D. With passive-aggressive behavior. 15. What is a common feature of social interactions for individuals with ASPD? A. Seeking long-term friendships. B. Exploiting others for personal benefit. C. Feeling overwhelmed by social obligations. D. Overly concerned with social norms. 16. Which of the following is a challenge when diagnosing ASPD in clinical settings? A. The tendency to exaggerate symptoms. B. A history of non-compliance with mental health treatment. C. The patient's reluctance to answer questions truthfully. D. The inconsistency in symptoms presented over time. 17. Which of these is a key consideration when developing a treatment plan for a person with ASPD? A. Immediate family involvement. B. Managing impulsivity and aggression. C. Avoiding confrontation during therapy. Maximizing social engagement and activities. 18. How is regulatory compliance typically monitored for individuals diagnosed with ASPD? A. Weekly therapy sessions. Periodic drug testing. C. Court-ordered supervision and monitoring. D. Monthly self-report surveys. 19. Which type of behavior is a hallmark of antisocial personality disorder in childhood? A. Difficulty in following social rules. B. Positive engagement in school activities. C. Consistent empathy towards peers. D. Adherence to authority figures. 20. How does the communication style of individuals with ASPD typically manifest? A. Highly emotional and empathetic. B. Clear and transparent. C. Manipulative and deceptive. D. Supportive and encouraging. 21. What is the prognosis for someone diagnosed with ASPD? A. High likelihood of full recovery. B. Improvement with age and maturity. C. Limited improvement despite therapy. D. Consistently deteriorating over time. 22. Which of the following is a major challenge in treating individuals with ASPD? A. They typically seek help voluntarily. B. They often do not recognize the need for change. C. They show a high degree of emotional sensitivity. D. They tend to respond well to group therapy. 23. Which of these is a potential risk for individuals with ASPD in community settings? A. Strong community support networks. B. The tendency to engage in violent or aggressive behavior. C. Highly cooperative interpersonal skills. D. Difficulty forming professional relationships. 24. What is the primary focus of cognitive behavioral therapy, CBT, for treating ASPD? A. Developing social connections. B. Changing negative thought patterns. C. Focusing on past traumatic experiences. D. Encouraging emotional expression. 25. Which of the following behaviors would be most likely in a person with ASPD in a peer group setting? A. Demonstrating strong leadership skills. B. Disrupting group harmony for personal advantage. C. Building consensus and maintaining peace. D. Encouraging others to follow group norms. 26. How is the severity of ASPD typically assessed? A. By evaluating their family history of mental disorders. B. Through a thorough assessment of criminal activity and antisocial behaviors. C. By monitoring their physical health status. D. By observing their social circle and interactions. 27. Which of the following traits is most commonly seen in adolescents who may later develop ASPD? A. High levels of emotional sensitivity. B. Unexplained anxiety or nervousness. C. A pattern of violating the rights of others. D. Consistently positive peer interactions. 28. What is the impact of early intervention on individuals at risk for ASPD? A. It can prevent the disorder from fully developing. B. It has no impact on the course of the disorder. C. It makes the condition worse. D. It reduces the severity but does not eliminate symptoms. 29. What is the most effective way to communicate with a person who has ASPD? A. By being emotionally available and empathetic. B. By using clear and direct language with firm boundaries. C. By offering leniency in interactions. D. By avoiding confrontation at all costs. 30. What is the main focus of mentoring techniques used in the treatment of ASPD? A. Building emotional intelligence. B. Providing career guidance. C. Establishing structured routines and consequences. D. Fostering personal relationships with others. 31. Which of the following best describes a typical response from someone with ASPD to a request for change in behavior? A. Resistance and deflection of responsibility. B. A willingness to comply and change their behavior. C. A thoughtful consideration of the consequences. D. A desire to make long-term sustainable improvements. 32. What strategy is most effective when mentoring individuals with ASPD? A. Encouraging open emotional discussions. B. Providing clear structure with predictable outcomes. C. Fostering close personal relationships. D. Allowing freedom without consequences. 33. What is a common feature of a person with ASPD's evaluation in a therapeutic setting? A. Strong self-awareness and desire to improve. B. A lack of understanding of their impact on others. C. Excessive empathy and social understanding. D. Unwavering commitment to treatment. 34. Which of the following is most likely to be a long-term consequence of untreated ASPD? A. Increase in social and professional integration. B. Development of strong interpersonal relationships. C. Continued criminal behavior and instability. D. Improvement in emotional and cognitive health. 35. In which of the following ways does ASPD differ from narcissistic personality disorder, NPD? A. Individuals with NPD are more focused on external validation. B. ASPD is more associated with impulsive behavior and rule breaking. C. NPD individuals show more emotional detachment than those with ASPD. D. Individuals with NPD are less likely to manipulate others. 36. Which of the following best characterizes a typical response from someone with ASPD to a request for change in behavior? A. Resistance and deflection of responsibility. B. A willingness to comply and change their behavior. C. A thoughtful consideration of the consequences. D. A desire to make long-term, sustainable improvements.